what to expect after an abdominoplasty, or the other name, of course, is a tummy tuck. And again, these are my reflections. Different surgeons will have different philosophies, and nobody's right or wrong. There's just different ways to do different things. So for my patients, I like them up walking even the first day. And what I stress to all of my patients, I want you to walk straight. I don't want you bent over with a hunchback in your back. Women will say, my girlfriend said not to stand up straight because you'll come apart. You will not come apart. Nobody's ever come apart in my practice. You will feel much, much better if you walk straight. You'll only get a sore back if you don't. Other people say, I was told you can't walk upstairs. I'm not breaking your legs. There's no reason why you can't walk up and down stairs. So it's very important to keep moving. First of all, you'll bounce back quicker, you'll heal better, you'll feel better. And as you know, one of the risks of any operation, especially a tummy tuck, is blood clots. And it's very important to be moving and walking to prevent that. The flip side of it is, I don't want you super active. I've had women say, I felt so good, I actually cleaned the house the first day. And again, that's overdoing it. So there's a balance like anything between resting and being active. I want you to eat all your meals at the table. I don't want you brought breakfast, lunch, or dinner in bed while you relax. It's not good for you. You want to be walking. I like all my patients to shower the very next day, and I know that's unusual for most plastic surgeons, but I've been doing it that way over 20 years. You feel better, you bounce back. I don't let you take baths, but I like you to shower. All of my incisions are covered with Steri-Strip, so the soap and water won't hurt it. The only thing you need to clean is around the umbilicus or belly button, and I'll have you again clean that with dilute hydrogen peroxide and a thin coat of antibiotic ointment. I rarely place drains. If I do place drains, I still let them shower and just have them clean around the drains. You'll be given an abdominal garment. I think you'll feel a lot better wearing it all the time. It's nice to have two because it will get sweaty and gross, so you absolutely need to wash it. Sometimes too, if you wear an abdominal garment all the time, your body gets really hot and you get a heat rash. So I tell my patients to wear it like most of the day, like 22 hours, but after you shower, and maybe one of them, just take it off and wear a robe for an hour and just let the air get to your skin. So what are some common complications that can happen? Any operation can have problems, and there's minor and there's major. What are some of the minor complications? Probably the commonest minor complication is something called seroma. And what a seroma is fluid that builds up underneath the abdominal skin and fat, but above the muscle layer. So it's the same fluid that if you got a blister on your hand, it happens in your lower abdomen. I like to see my patients twice in the 3 to 8 day range, and that's usually when it'll appear. And how can they tell? The patients will often see it themselves. They'll give a little jiggle when they get up in the morning, and they'll look down and they'll say, wow, it feels like there's a little water sloshing around. That's exactly what it is. It's nothing to panic about. They don't have to call me at 2 in the morning. And what I'll do most of the time is you're actually completely numb above the incision. So I'm able to stick a needle in it, I'll have them not watch, and I draw that fluid out. And it doesn't hurt, it's painless, and they'll feel better. Usually if you get a seroma, and I think it happens about 10 to 15% of times. The figures are all over the place when you look at reports, but that's a good rough number. About 10% of patients will get it. And it's not always the heavier ones, it's not always the skinnier ones, it just happens. But if I have to tap you, that's the technical term for it, I usually need to do it 4 or 5 times, and I usually do it every 2 or 3 days. Most of the time that's all you need, and it'll just go away on its own. So that's probably the commonest complication. What about wound breakdown and wound infections? I give all of my patients 1 dose of antibiotics through their IV. That's all they need. They don't need to go home with any more. But you can still get an area of wound breakdown. The reason for that is there's tension on the incision, there's less blood supply, so you can get a little area of breakdown along the incision sites. Most of the time this will heal with just conservative wound care, which for me means cleaning with dilute hydrogen peroxide and a thin coat of antibiotic ointment a couple of times a day. And usually it's quite small, the scar will heal quite nicely, and it's very unlikely anything more will need to be done. Sometimes patients will get low-grade infections. How will you know? It's like any infection. It'll be red, it'll be swollen, might be a little bit sore. Of course you need to let your doctor know about that. Most of the time that will respond very nicely to oral antibiotics. Every once in a while somebody has a more severe infection, I'll either involve infectious disease, or they might even need an IV, but they can usually get that at home. So again, these aren't common, but they can happen. It's nothing to be too concerned about. What about blood clots? Blood clots are a lot less common than they used to be. Virtually all the operating rooms now use what's called pneumatic stocking, so they'll put a pneumatic cuff on your calf of your leg, and that will pump the blood while you're asleep. I personally, when I do an operation that takes more than 3 or 3.5 hours, will put most of these patients on what's something called Lovenox. And it's a small little needle they'll give themselves starting 12 hours after surgery, and they'll do that nightly. And that doesn't prevent it 100%, but it makes it extremely low chance that they'll get a blood clot that can go from their calves to their lungs. Not every doctor does that, but that's my own personal philosophy. And as I've also indicated, I get you out walking and being active. So those are really the commonest problems. There's always some swelling above the incision. Some women and some men will have beautiful incisions very quickly. Other people, really takes a year for everything to settle down, and that can vary from person to person. And it's not a function of the skill of the doctor, just people heal at different rates and people hold fluid down. So it's very important that you realize you're going to keep improving for at least a year, many times much longer. So you need to have a longer view of how long it takes before you look your very best. I always stress to patients too that this is a part of changing them, but if you're a little bit heavy set, there's no magic. If you diet, you exercise, and look after yourself and work on improving your weight, you're going to get a much better result than somebody who unfortunately decides to put on weight after the surgery. So it's really an interactive process between the patient and myself, trying to make them look and feel their best.